happened to me in my personal life. So one of my very close friend from Tampa, she having her 6-month-old, and phoned me one day and said that, Avi, I don't know, for some reason I'm developing a lot of sharp pain and stabbing feeling around the base of my thumb, and every time I'm nursing my baby, or gripping and pinching and holding, dressing, doing all sorts of mom thing that she has to do, and that she's unable to. And now the frustration part was that her husband, who's a very close friend of mine, couldn't come out for one of our trips. So and for all those selfish reasons, I had to suggest something to her to fix her, which I thought, and if I take my memory back, as we know, we have an 18-month-old son as well. And Jenny developed a similar issue a few months ago at that time. And so now that I have a sample size of a few other moms as well that I've seen, I feel this is a mom problem that people develop after they've delivered their baby in a few months, because of repetitive use of their hands, wrist, thumb. And also there is some association of some hormones as well, that certain hormones lead them to have carpal tunnel problem. Similarly, a lot of other wrist and thumb problems. So I got two simple things to suggest when you're going through these pain. Give these a try and let me know if they help. So the idea is that if your wrist is like this, you'd want to let it, so the pain is around this base of the thumb, you'd want to let it deviate to one side, towards the pinky finger side, and then with your other hand you'd want to let it rotate, and then you'd want to also cause a lot of rotation to your wrist, so you're slacking that area, and see how if you feel better with that. The second technique would be with your wrist, instead of going to the pinky finger, now you're letting it come towards your thumb side, and now any kind of movement away from your hand is where you feel the discomfort. So you're doing the opposite. We are letting the thumb go in, let this joint bend, so almost in a the bent position, the most bent position that it could be. And then once you've got there, you're just trying a gentle rotation towards the opposite side, or you're trying a further stretch and a bend over to the inside part of it. And that will give a little bit of a strain around this area, but one moment you let go of it, and then it should almost resets it, and should feel better. Give this a go and see how you feel. Even if it tend to cause more pain, then that's also an important issue. Then that may not be de Quervain syndrome, maybe something else associated with it. So I'd like to know so that I can suggest you something else.